Hello there, my lovely. Take a seat and make yourself comfortable. My name's Dr. Sarah, and I believe you're here today for me to take a look at your ears and clean them out ahead of some surgery, yeah? Okay. So you have just some little growths just inside both ear canals that need removing. Yeah. They're completely benign. You have been told this, haven't you? Yeah. Yeah. Okay, that's fine. Right. So at the moment, have you got any ear pain at all? Right, okay. You just get a lot of pressure from the wax build-up. All right. Okay. Feeling generally well? Good. Good. Okay. So I'm just going to grab some gloves and take a little look at you. All right. You don't have a latex allergy? All right. Okay. Let's get these on. That one's broken, so we'll try another one. Sometimes they're a real pain, these gloves. And when you've been wearing them for a while, you just get so sweaty and horrible. And I have to wear them a lot during the day, so in this hot weather it's not pleasant. But here we go, that's better. No broken ones there. Okay, so I'm going to have a little press around your outer ear. Alright, then I'll be looking down the ear before I proceed to clean. Okay, I need to take a little look just to see which method I'm going to use to clean out the ears. Alright? Okay, so I'm going to give the ears a little wipe around first. Okay. Right, I'll do this left ear first. Just a gentle wipe around. Okay. Nice. Good. Okay. And I'll do your right ear now. There we go, all done. So as I said, I'm just going to have a little palpate around the ear, a little bit of tugging on the ear, a little bit of tapping, and just feeling around for any lumps and bumps on the outer part of the ear for now, okay? Right. Do tell me if anything does feel particularly uncomfortable for you, my lovely. I can always stop. Okay, here we go. Going to pull up on the ear a little bit there. And look behind. Okay. Everything looks and feels fine there. Alright, let's take a look at your right ear now. Pull up a little bit there. Okay, and look behind. Everything is also fine on that side, so we're off to a good start here. Okay, so next I'm going to pop an otoscope down your ear. Let me just turn that on. There we go. And it's got a light which I will just shine down the ear canal to see what's going on, to see how much wax is down there, and to see if there's any other signs of infection. And I can also have a little look at those growths that are going to be removed. All right? Okay, please keep your head very, very still, my lovely, all the way through when I do this. Pop up your hand if you want me to stop, that's not a problem. Okay? Perfect. Right, here we go. Right, so I'll need to pull up and back on your ear very slightly there. Okay, and I'm just going to insert the otoscope now. There we go. So let's take a look. Okay. Yeah, there's definitely a lot of wax built up down here. Looks quite impacted as well. So I can't really see anything of your eardrum. But I can see the little growth there. It isn't anything to worry about, but we do like to remove them if possible. Positioning just so I can make sure I've got every angle there. But that's okay. I can't see any signs of infection at the moment, so let me just take that out of there for you now. There we go. You all right there? Perfect. Okay, here we go to this side. Okay, up and back and insert in now, okay. Okay, there we go. Again, lots of impacted wax on this side also. And a little growth there I can see. No obvious signs of infection or inflammation. Right, let me get that out of that view. There we go, just relax there now. Just to update my notes a second. So there is a lot of impacted wax down both ears. So what I propose to do is to pop some special drops down your ears, okay? Those are going to break down that wax very, very quickly. You will hear some fizzy, crackly sounds as they do so. It's not painful. My patients love it. They say it's a very pleasant sensation, okay? So I just need you to keep really still while I do it, and then we'll get to work on breaking this wax down. Then I can start to remove it, okay? You happy with that? Let me just get a couple of things ready there. Okay. Right. Just have to give these drops a good mix. They are stronger than what you can buy from a pharmacy. You can get some similar, but these are a special formula that we make here just for use in this practice. Okay, they're looking good. Alright, keep nice and still. Just going to pop a couple in each ear. Alright, my lovely? Okay. Here we go then. Here's one. And two. Give that a little rub. Okay. You like the sound? Perfect. Okay, so that's getting to work in your left ear. Let's have a little look at this right one. Okay, so here's one. And two. Just give that a little massage in. Okay. All good. So you're fitting nicely. Perfect. Right then. So what I'm going to do first, my lovely, is I'm going to use this tool here just to have a scrape around to remove that wax as best I can, okay? Yeah, now, as I said before, please keep still, just pop up your hand if anything is uncomfortable, but I'll be as gentle as possible. Usually these drops are really good at softening the wax straight away, so it makes it very, very easy for me to just pull it out, okay? Alright, so let's go. Okay, just going to go in now with the tool, my lovely, and start picking a little bit. got a lot out of there. So I'll take a look at this side, all right? Just going in with the tool now, my lovely. There we go. Right, I'm just going to have another look down your ears before I decide whether I need to do some more picking or whether I can just go in with a brush and tidy things up. Okay, let's pop that on. Okay, I'll pop it in the left side first. Okay. Just pulling up and back again, my lovely, and in we go again. Okay. Right. That actually looks really good. I can see your eardrum. So it looks fine. There's no bulging, no wrinkling. It's not retracted. The structures behind are clear and look normal. The growth is visible and it will be easily accessible to remove now. Absolutely fine, lovely. I'll just need to go in with the brush. Okay, let me just remove that. Doing all right there? Perfect. You're an excellent patient. You keep very, very still. Here again now. There we go. Right, let's take a little look. Yeah, I can now see the eardrum on this side too. Again, perfectly normal presentation. Ear canal looks fine, slightly red from the impaction, but there's no infection there or no sign of any skin irritation particularly. There's no bleeding or oozing, so that's good. Just needs a little brush out. I can see the little growth on this side as well, but again that will be easily accessible when we get you back in for the removal of these. Okay. Right, so for my next trick I've got a very lovely little brush here, okay, and it will just gently remove any excess particles of wax and debris from the ear canal. Okay? Yeah. Okay, just keep still as usual for me, my lovely. Okay, it might sound a little bit loud in your ears, but it's not going to hurt you at all. Okay? Alright. Here we go. Just popping that in now. And let's have a little brush around. Not going to do anything else down there with the brush now. You like that? Good. We can't leave the right hand side out now, can we? So let's go in there with this and do the same. Okay, here we go. Okie dokie, that looks fine. Right, do you feel okay? Not dizzy or anything? That's good. Okay, so I'm going to pop another couple of drops down. Actually, I'm just going to give your ears a little puff of air just to get rid of anything that may be on the outside before I put the drops down. Okay? Right, so here we go. You might like this. Okay, right. Put a nice couple of soothing drops down because I've been working inside the ear. This just helps calm any irritation. It won't numb them up, but it just soothes them. Okay, here's one. And two. Okay. Quite nice. just a little couple of pops around. Some lovely soothing drops. There we go. 1 and 2. How are your ears feeling now? Okay, good. Just going to give them a little massage now with those drops being down there. Okay. There we go, my lovely. So you're all done, and we'll see you in about a week's time for the surgery, okay? Yeah, we'll soon get rid of those little growths for you, and you won't feel a thing, I promise. Yeah. If you've got any questions or you're nervous, just give us a call and I can talk to you. Okay? Any problems in the meantime, also give us a call. But I think you'll be fine. Alright? Okay, so enjoy the rest of your day and I'll see you very soon. Take care. Bye-bye. Oh, hello there, my lovely. Take a seat and make yourself comfortable. Nice to see you again. How are you feeling? Good, good. So we cleaned out your ears last week, didn't we? Have you been fine since then? Good, okay. And I'm going to remove those little growths today that are inside your ear canal. Now, we think that they're just little cysts, so nothing to worry about, and they should be easy to remove. Yeah? Okay. So have you got any questions for me? Okay, lovely. So you do feel well, you've got no signs of infection that you're aware of. Okay, lovely. Right. So I'm going to pop on some gloves. I'll first clean around the ears and then have a look down. Just a little look down before we do anything down there. Okay. Okay. Just going to get your ears cleaned on the outside with a little wipe, alright? Okay. Just like before, just a very gentle little wipe. Okay. Right there, good. And let's do the same to your right ear. to pop a protective cover over the back of your ear, okay? Yeah? It's just to stop anything dripping out of your ear while I do this, okay? Yeah? Alright, just bear with me. Just going to pop it over there like that. There we go. I've got one ready for your right ear. Lovely. Perfect. Right. So firstly I'm going to look down both ears with the otoscope again. Okay. And make sure that everything still looks all fine. There's been no significant changes, alright? Okay. Take a look down this ear first. So I'm just gently going to pull up and back, my lovely. Insert the endoscope now. Okay, here we go. Keep nice and still as you fall. There we go. Okay, so ears still looking nice and clean. And I can just see that little bump there in your ear, which I'm going to remove today. Ears have calmed down nicely after all that impacted wax was moved. That's perfect. Okay, just withdraw that. Okay. You doing all right there? Perfect. Right. Onto this side. So just going to pull up and back, my lovely, and insert that now. Okay. There we go. Well done. I can visualise everything down here perfectly well, so that's good. All looking fine. There we go. Okay, so everything's looking perfect, so we're good to go. Alright, so I can't inject inside your ear, so what I'm going to do is just use some anaesthetic drops, okay? These will numb the ear canal. Now, because these are like little cyst bumps that are inside your ear, I should just be able to make a very, very small incision, okay, and then just extract the contents, alright? If I come across anything untoward, obviously I'll let you know, but I'm pretty sure that these are just going to be some cystic lumps that once the contents are extracted and there's a little sac in there, I'll be able to remove that as well, but you won't feel it once I've popped the drops in, alright? So here we go, let's pop a couple in here. Get that cover ready in case anything runs out. Here we go then. Here's one. And two. Okay, we've got a little you just sit a second. Okay, so let me just grab the tools. I have laid things out here. Okay. Got those. Alright. So I'm going to just test your ear, okay, to make sure that you can't feel anything. Alright, so let me just go to your left ear first, and I want you to tell me if you can feel anything when I put this sharp tool down your ear and apply some pressure. Okay, can you feel it? Feel that? Feel that? Okay. Okay, perfect. The drops do work very, very quickly. Okay. So, and again, could you feel this? This. This. Alright, I'm happy with that. That's all good then. Okay, so are you ready for me to begin? Alright, I'll talk you through everything, don't worry, okay? Right, a couple of little things there. So what I'm going to do first is just make a very tiny incision in the top of the bump, alright? And then I'll talk you through what I'm doing, okay? Alright. We'll do this side first. Okay, so just coming in now and making a little incision. If you can feel anything, pop up your hand, but please keep still, thank you. Okay. There we go. Okay, so now I'm going to insert the tool and apply some pressure onto this. Let's take a little look at what's going on there. Ah, it is a cyst. Cystic contents coming out there. Right, just going to apply some pressure. Is that feeling okay for you? Right, now just going to get the tiny scissors here. I'm just going to have a little tug and try and extract the little sac that's inside, okay? Just a tiny little sac, alright? Just going to feel me tugging a little bit now. Can you feel anything? Okay. Right, there we go. bit of pressure onto that with a special piece of cord, okay? Doing really, really well. Okay, just going to have a look down now with the otoscope. Just very, very slightly inside the canal. Here we go. Yeah, that's looking fine. Absolutely fine. Hardly anything in the way of bleeding. I wouldn't be stitching that or anything. It's just like a little cut, very small cut. Okay. Well, okay. Right. How are you feeling? Good. You're doing really well. Yeah. I'll see what I can do on this side now, my lovely. Okay, just you relax there. You seem rather relaxed, so that's good. Okay. So, firstly, I'm just going to make that tiny, tiny incision. Okay. Here we go. Right, just start extracting that cyst. So you'll feel some pressure, but you shouldn't feel any pain at all, okay? We've had a matching pair here. Often we see them in both here. There you go. Pretty much gone now. Right. So now I'm just going to again start tugging a little bit just to get that sack out, so you will feel something there, okay? How are you doing? Good, right, I'm just going to let you relax there for a second. Just to update that. Now it looks like I've got all of the sac out, both of these little lumps, okay? If we don't get the sac out, it can refill and come back, so it's really important that we get the sac out. Very, very tiny thing, and it came out in its entirety, so that was good, because sometimes they can be quite fragile and break up, and then we have to go a little bit deeper, which, you know, isn't too pleasant, particularly in the ear. Yeah, okay. So you're not feeling dizzy or anything like that? Right, okay, perfect. Right. So, your ears are going to get a real treat. I'm going to put some different drops down now. These are an antibacterial drop, okay. I'm going to get you a prescription of these to take away with you, just to help heal over the wound and stop any infection. Please don't put anything down your ears, don't use headphones, swim, and if you can, try not to get too much water down there if you shower, alright? Just for about 4 or 5 days. It'll soon heal. But I'm going to put some of these in. And I'll get you that script, as I said, to take away, to use at home. Just use them 3 times a day, okay? Here we go. So there's 1 and 2. Lovely. Just a little while. I can remove that plastic cover now. Perfect. And just a little massage there. Okay, perfect. And on this side. Okay, here's 1 and 2. Okay. Wipe away any excess and remove that plastic cover and give you a nice little ear massage there. There we go. Right, just rest a second. I'll just get that prescription sent over, and the pharmacy will have that ready for you in a few minutes. Okay, so any problems, any severe pain or unusual discharge, please come and give us a call. We can look at you again. If it's out of hours and you're in a lot of pain, you can also go to A&E. I really don't think that's going to happen. These are tiny, tiny cuts, and if you use these drops and You know, you don't get water in there, you don't use headphones, you don't put anything in your ears. Okay, you should be absolutely fine. Yeah? Perfect. All right. So if you're feeling fine, you're free to go. We'll see you in about a week's time. All right, but go and get your drops from the pharmacy. Okay? And take care and enjoy the rest of your day. Okay, my lovely. Take care. Bye-bye.